Inpatient, outpatient, observation. What status are you at? What does it mean? Why should you care, especially if you're a Medicare patient? Welcome, I am the medical bill whisperer, a previous billing manager turned patient advocate. I am here to give answers, insights, and solutions to patients like you. So what are inpatient, outpatient, or observation statuses? Well, these are the three types of status a patient is assigned when medical services are rendered in a facility. A facility being an actual building other than your home. A setting, for example, an ER department, hospital, clinic, surgery center, rehab center, nursing home, imaging center, skilled nursing facility, residential treatment center, dialysis center, infusion center, where specialized and specific equipment is available, as well as skilled staff, beds, supplies, for an amount of time either less than or greater than 24 hours. So the facility is the building itself, but also the type of service rendered to you. And the status ultimately assigned to you in outpatient or observation will be determined by the level of care provided, the scope of the services rendered, the seriousness of the medical circumstances, the time spent at that facility, the medical decision from an ER doctor, supervising or referring physician, and the insurance guidelines, especially if you have Medicare. Now, those three types of status will always apply to medical, behavioral, and mental health events, and yes, even dental. So it's most important to know what status you are kept under, as administrative and financial consequences are affected by it. Let's start with inpatient. This means that an intervention, treatment, or range of medical services required you to stay at least 24 hours in a facility or overnight. It means you were formally admitted to that facility by a physician. Now, you can start as being outpatient or even under observation and be inpatient after a doctor determines that you can neither be discharged nor stable enough to be transferred. You can also be inpatient for a pre-scheduled occurrence like a procedure, treatment, or a rehab stay. They require an inpatient stay if you have been prescribed by a physician behavioral or substance abuse treatment, physical rehabilitation after an accident or adverse event like a stroke, or skilled nursing facility care after being in a hospital. For procedures or treatments that are more complex, with a high risk of complications, that are life-threatening, that require post-op monitoring or high clinical level of post-care, could also lead you to be inpatient. Trauma usually also means an ICU stay and inpatient status. Outpatient is the status if an intervention, treatment, or medical service requires less than 24 hours or a lower level of care. These services can be rendered in a surgery center, clinic, lab, office, infusion center, imaging center, dialysis center. Most of services are considered outpatient by default. ER departments, hospital, psych, or rehab facilities can offer both in- and outpatient services if minor or shorter-term treatments are needed. The trend has been that more and more surgeries are even considered outpatients. For example, hip surgery will send you home the same day. However, you have some form of surgical intervention or treatment that leads to complication and an admission, and therefore change to inpatient status. Observation is the in-between status when you are neither too sick to be admitted nor stable enough to be transferred or discharged home. If a physician needs more time to determine a final diagnosis or whether you should be admitted or discharged, you are considered in observation. This status has grown because of the advantages. First, the care delivery process is more efficient, knowing that you will not need to be staying overnight or for a long period of time. Inpatient beds and services can then be used for those who truly need them. Better use of services means less services and less of a rush for immediate, aggressive, and therefore costly measures. Lower cost to insurers and patients is definitely reward. Now, this affects mostly original Medicare or Medicare Advantage patients. And for more on Medicare, do watch my videos on that topic. So why should you care? Well, if you have a commercial plan, meaning non-Medicare or Medicaid, inpatient services will usually require a pre-authorization or notification if admitted when you were not supposed or anticipating to, whereas outpatient or observation services often do not require authorizations. All services have their own level of reimbursements and coverage. Now, there may be limits on services that last a longer time or are more expensive, even if outpatient, for example, MRIs, psychotherapy, chemotherapy. But these are exceptions. If you have original Medicare, also called straight Medicare, services do not require pre-authorization to be inpatient or outpatient, but will be paid under different parts. Part A covers inpatient services, Part B covers outpatient and observation stays. Now, observation under Medicare can last up to 3 days, even if you are kept at the hospital the whole time, even sleeping in a bed. But the hospital must give you a written notice on day 1, as the cost to you will be higher under Part B. Medicare also, it's the number of days it will cover with a different cost to you. The longer you stay, the more you pay. As for skilled nursing inpatient days, those are limited as well and require a 3-day inpatient stay at a hospital before being covered. If you are under observation at the hospital for 3 days and get transferred to a skilled nursing facility, Medicare will not cover those services. Now, if you do have a Medicare Advantage plan, also called Part C, the same rules, coverage guidelines, and payment limits will apply, and in addition, pre-authorization may be needed for many, if not all, inpatient services. Each policy is administered under a commercial private insurance company, and therefore, even though the same rules will apply as Medicare, the final share of cost may be different. Now, this is a little complicated, but I will leave you with some tips. The most important is stay informed and ask questions. What is your status on a daily basis, especially if you are under observation and especially if you have Medicare? Be aware that your status can change while in the hospital because a doctor may finally decide to switch you from observation to inpatient or even back to observation will affect your cost. And if you can, get it in writing. If you have a pre-scheduled surgery, get confirmation of a status ahead of time and make sure to inform your insurance if you will be inpatient. Confirm with the ordering physician or per facility, whether a necessary authorization is needed and has been obtained. Double check what the status is listed as final status on your medical records. It must match what your doctor tells you and what the insurance is being billed for, especially if your status was changed during the stay or if you have Medicare. And if you were in the hospital or facility because of emergency conditions, where that no authorization is needed per the Federal No Balance Bill Act. However, should you be admitted, an authorization may be, or at least notification be given. The same No Balance Bill Act will force your insurance to pay more and medical providers to bill you for less, saving you money while you recover your health. I so thank you for watching. Your likes, comments, and subscribe help support this channel and my efforts at reaching out to more patients like you. So, thank you.